Good day, ladies and gentlemen. Welcome to another exciting time on Earth Lights with Adesua. My name is Blessing Adesua Lafi, and I'm your host on this program. The vision of this program is primarily to break the cycle of life-threatening illnesses. Some illness which perhaps could have been prevented, but due to lack of awareness of the people, which I call ignorance, some life has been lost. Through this program, a wide range of your personal health needs will be met. Through our professional doctors, we will be digging deep and dealing with various kinds of diseases, the causes, the cure, the symptom, the treatment, and also how to prevent them. On today's edition, we have a very important topic: fistula. What is fistula? Fistula is an abnormal or surgical made passage between a hollow or tubular organ and the body surface, or between two hollow or tubular organs. To simplify it, an abnormal connection between two body parts is called a fistula. It is called poo poo sickness and pee pee sickness here in Liberia. For an insight into today's topic, I have a professional medical doctor in the house here who will be talking deep down on today's topic. Don't go anywhere, we'll be right back after this break. Welcome back. It's still Earth Lights with Adesua on Tama TV. We have a medical doctor in our midst. He's a professional medical doctor from the Democratic Republic of Congo. He's the medical field coordinator for Fistula project in Monrovia, Liberia. He has been in Liberia since July 2014. He has also worked for the period of 8 months at the Ebola Treatment Center, ELWA. He worked with German Clinic for 6 months, and presently he has been working at a Catholic hospital for 2 years and 3 months. He is no other person than Dr. George. Hello, Dr. George.
Hello.
How are you, sir?
I'm fine, madam. Thank you.
All right. Can we get to know you more?
Yeah, I think that you're from saying everything about me. Okay. I'm Dr. George Oleko, like you said.
Okay.
I'm a medical doctor from the Democratic Republic of Congo.
Okay.
And I have been in Liberia since 2014, and we worked for 18 months in Ebola Treatment Center here at W2.
Okay.
And after the Ebola Center, we went to German Clinical State. And since 2 years and 4 months now, I'm working to Catholic Hospital. Okay. In OB/GYN department.
Okay.
And I'm the medical field coordinator of the Stop Fistula project. That is a project of the Women for Africa Foundation.
Okay, the Women for Africa Foundation.
Yes, which is a Spain foundation. Okay. Who have many actions in Africa. Okay. And in Liberia they have different projects in different countries in Africa.
All about women?
Yes, okay. All just about women, because the president of the foundation is the former vice president of Spain.
Of Spain.
It's a woman.
Okay.
So he's providing action to support the women in Africa. So in Liberia we have the Stop Fistula project. We established it since 2013. And we are taking care of the fistula patient, the patient at risk of developing fistula. We are taking them in charge, free, those at risk who can come deliver to Catholic Hospital free of charge. The foundation, yes,
wow.
The foundation can pay the fee for them. Okay. Just because of the complication of the home deliveries. And we noticed that most of them was explaining that they're forced to give birth at home because they don't have money to come to the hospital.
But so, now they're having a free medical facility.
Yes. And yeah, we are giving them that. And apart from that, we record all the fistula cases. Okay. And we have 2 surgical missions per year. We have at least 9 doctors who can come from Spain.
Wow.
With myself, and we can conduct that surgical mission free of charge to Catholic Hospital.
Okay, so you mean doctor fly down from Spain to Monrovia again?
Yes.
To get the patient treated?
Yes. I'm here. I can register the patient. We keep them to the hospital, Catholic Hospital.
Okay.
And the surgeon comes from Spain. We do the surgery. We repair the fistula.
Wow.
And we keep them. After that, most of them can go back home, queue, and the other can go to the rehabilitation center to Phoebe.
Okay.
Yes, that is mentioned here. The fistula is the communication between the bladder and the vagina that allow continue a voluntary discharge of the urine into the vaginal vault.
Okay, sir.
Yes. That is in short the definition of the fistula.
Okay.
And especially in vesico-vaginal fistula.
Okay.
So all communication between two different cavity of the body is called fistula.
Okay.
But especially in case of women, we talk about vesico-vaginal fistula or recto-vaginal fistula. That means that there are connection between the bladder and the vagina, or the rectum and the vagina.
Okay, sir. What is the cause of fistula?
The cause of fistula, I want to mention that we will talk specially about vesico-vaginal fistula.
Okay.
Because the fistula can be for different organ in the heart, the different cavity of the heart. The communication can be there. You can call it fistula too. And but in vesico-vaginal fistula, the cause are during the deliveries. It means that while a woman comes for deliveries, and the others are not able to deliver by themselves for different reasons. It can be that the child is big according to the mother pelvis, or the presentation is not good for the woman to deliver by herself. And those women can stay in labor for a long time. Because normally a woman who come deliver for the first time need to stay in pain for at least 18 hours.
Okay, yes, because I was about going there. For the first time a woman gives birth at least 18 hours. That's a time of period of labor. But some people exceed 18 hours and go like 2 days, 3 days.
That is the risk now, because when they pass 18 hours, it means that the fetal hair can be pressed, the bladder, the mother bladder. And while the pressing are there, the blood circulation is not too good. And that part, the part of the bladder who is in contact with the child head will stop receiving blood. So after time, it will be necrosis of the bladder part. It will create one hole from there, from the bladder to the vagina. Yes.
And that is the cause of fistula.
Yes.
Okay. Wow. Thank you very much for that, sir. You made mention of the baby head being too big. Can we say these are one of the symptoms of fistula? Can the doctor really see that the baby head is too big before delivery? Can it be avoided?
Yes. First of all, the symptom of fistula is not the presentation or what. When a woman comes with fistula, the first symptom, without touching, we feel the urine odor. Because they are losing the urine continuously. So once a fistula patient passes near you, you feel the urine odor. So that is the first symptom before going and try to check to see where the hole is localized in the bladder to the vagina.
So that is number one symptom, the urine.
Yes, the urine. So the main symptom.
It keeps coming without stop, or it's like, does it happen? Because there's some people, they go to the bathroom and pee like most of the time.
No, there we talk about incontinence. But when we are talking about fistula, it means that the urine can be stayed in the bladder, because normally our body is producing the urine every minute. And the urine can be kept in the bladder. And once the bladder is full, then the brain can send you to urinate.
The signal.
Goes to the brain. Now once you get a hole in the bladder, it means that the bladder can be full. So if the bladder can be full, you will not feel need of urinating.
Okay, it doesn't give a signal to the brain that I want to go and urinate.
No, you will not feel it. For the brain will continue to think like the bladder is not full. Okay. And the bladder can be full because the urine is going one time. It can be kept in the bladder. Okay. So nowhere for the bladder to be full.
Okay.
So those patients, the fistula patient, don't feel need of urinating because the urine continue going from the kidney. Instead of stopping in the bladder, going outside directly. Okay,
just like our doctor has said that the urine keeps going. It doesn't give signal to the brain that I want to urinate because the urine keeps on coming out, which means the urine comes from the kidney down to the bladder and just to waste. Stay with us after this break. We'll be right back. Welcome back. Okay, Dr. George. Who are those that are at risk of fistula?
Yeah, we have many categories of patients or pregnant women at the risk of fistula. We have pregnant women less than 20 years.
Okay.
Less than 20 years just because the pelvis are not strong. Okay. And apart from that, we have the tiny women, the short one. Those one, the pelvis are small too, the short pelvis. Okay. They are at risk because they are not to be able to deliver by themselves. Okay. And we have the women with the obstruct labor. Okay. Obstruct labor means that a woman who stay in pain more than the time that she was supposed to be. And they just for different reasons. It can be the child big or the malpresentation of the child. Okay. Yes, that was those at the risk of developing obstetric fistula. Right. Yes.
Okay, thank you.
Apart from the what we call the iatrogen fistula too.
What is the iatrogen fistula?
Iatrogen fistula means that the fistula were created by the doctors. I can say the doctor during the surgery. Okay. Because you can go doing perhaps a cesarean section. And if the surgery is not good performed, you can go and cut perhaps the bladder because the bladder are too close to the uterus. Okay. So if you don't pay attention or the delivery is hard by doing the cesarean section.
Go through hard labor.
Yes. Yeah. You can go touch the bladder there, cut perhaps, and get from there. Wow. Yes, that is how they can be done. Or when they go for hysterectomy, hysterectomy means that they go move the uterus.
Okay, doctor, you said fistula can happen through. Is it the mistake of the doctor or during the surgery?
Yeah, during the surgery, but it will happen while the doctor is doing. We call it mistake of the doctor.
Mistake of the doctor.
We can explain the surgery can be hard, but when it will happen, we say that the doctor did not perform well the surgery. Yes. To me, the patient did not come with the fistula, but after surgery now, the patient start developing the symptom of fistula.
Okay, so when someone start developing the symptom of fistula after the surgery, what do you think that person should do? Is there going to be another surgery?
Yeah, well, there we reach because the treatment of fistula is surgery. Okay. Because you have a holiday, you need to go and suture. So the treatment of fistula is surgery. Okay. So if someone get fistula during the surgery, to repair the fistula, the person will need another surgery for repairing. Yeah.
All right. Thank you very much, doctor. What are the traumatic experience of surgery? Will the patient develop a traumatic experience after the surgery, or will she still be normal? Will she still be able to live a normal life after the surgery? Or will there be any kind of consequences after the surgery?
Yeah, what is true is that fistula is a sickness like other sickness. Okay. The treatment, like I said, is surgery. And we need to notice that the surgery of fistula is not an easy surgery, just because after the surgery you work in the bladder. The bladder is receiving the urine anytime. And once the urine stay in the bladder after surgery, okay, it will block the suture we use to suture the place. The hole is there.
Okay.
That is, it needs many management, good management to succeed the fistula surgery. But after surgery, for those who succeed, they come back with normal life.
Okay.
They can get out of pregnancy and become normal in the community. Yes.
In the community.
Yes.
Okay. All right. Thank you very much, sir. What is the prevention? How can fistula be prevented? Poo poo sickness, pee pee sickness. How can these be prevented from happening?
Okay. The prevention of fistula is just to come to antenatal consultation.
Okay.
Once someone is get pregnancy, because when they come to antenatal consultation, we will have knowledge. We can detect soon to see that this patient will not be able to deliver by herself. And apart from then, to push them to not give birth at home. Because when they give birth at home, they will not notice soon that the patient passed the time that she normally need to deliver.
Okay.
And when they are to the hospital, the health care can see and can decide soon and act to do perhaps a cesarean section to help that woman to deliver, instead of waiting until the patient develops fistula. Yes. So the prevention I can say is to come to antenatal consultation, to not give birth at home.
Okay. Thank you very much, sir. You've heard it all from our doctor. Do not give birth at home. Traditional method is a very dangerous one, and one can be at risk of fistula, which is the poo poo sickness and the pee pee sickness. So, Dr. George, lastly, in conclusion, what is your advice to young women out there concerning this fistula?
Yeah, for the young women or all those at a risk of fistula, I think that according to experience, according to the percentage of those who developed fistula, we see that 60 or 75% of those who develop fistula are those who try to give birth at home.
Okay.
So once they come to the hospital, they have a high chance to deliver without complication. So the advice is to come to the hospital, to not try giving birth at home, and to come to antenatal consultation. Because once you come, there are other patients we can see. I can do the ultrasound and see that the child is big according to the mother pelvis. So we can plan a surgery and we act in advance before the patient can develop that sickness.
All right. Thank you very much, Dr. George, for this wonderful one. Thank you, sir. It was nice having you, and it was nice being here with you, actually. Welcome back. You're on Flight with Adesua on Tama TV. You've heard it all from our doctor, Dr. George Oleko from the Catholic Hospital, discussing widely on fistula. Fistula is the abnormal connection between two body parts of the organ in the body, and it is also caused by lack of proper antenatal care and also giving birth at home. This is very, very dangerous. So to all the women out there, let us come to the hospital when we're pregnant, and also do not try to give birth at home. Thanks for watching today at Light with Adesua, and always remember, stay healthy, stay happy, and always be on guard. Your health is your wealth. Thanks for watching today's episode. We hope to see you next week on another edition of Light with Adesua. Don't miss out. From my hand here, it's bye-bye.